Hey guys, Nick here, dialysis nurse. So a patient actually messaged me a question about anti GBM. Now this person was recently diagnosed with this, and they just want to know the risk of kidney failure or end-stage renal disease. So first, I'm going to talk about what anti GBM is. Anti GBM is also known as Goodpastures Syndrome. Now this is a very rare autoimmune disease in which the immune system basically attacks your kidneys, and sometimes it can actually attack your lungs as well. Now, this leads to rapid, very severe kidney damage, which could also lead to chronic kidney disease and end-stage renal disease or end-stage renal failure. So what happens is your kidneys are very unique. I'm not going to talk about the structure of the kidneys because there's just a lot, but you'll get something called glomerulonephritis, and that's inflammation of an area of the kidney. Anything ending in itis means inflammation. So this inflammation of the area of the kidneys can lead to kidney damage, which leads to chronic kidney disease and in the end-stage renal disease. So symptoms of anti-GBM are blood in your urine, which is called hematuria, protein in your urine, which is called proteinuria. If the anti-GBM does affect your lungs, then you can cough up blood. And just general weakness and fatigue is also a pretty common symptom of anti-GBM. So to diagnose it, we do a blood test. The blood test tests for anti-GBM antibodies. Sometimes they have to get a sample of your kidneys, so they'll do a kidney biopsy. And sometimes they have to test your lungs as well, just in case your lungs are also involved. The treatment for anti-GBM is usually something called plasma apheresis, which removes the antibodies from your blood. Corticosteroids, remember we talked about steroids before. Steroids reduces your body's immune defense system. So basically, your body's defenses is lowered when you take steroids. And also just immunosuppressive medications to reduce that inflammation that's happening to your kidneys and possibly your lungs. So the thing about anti-GBM is it's really rapid. Like when you get this, it attacks your kidneys pretty fast, and you can go downhill pretty fast with anti-GBM. So sometimes dialysis may be needed to help support the kidneys immediately, and early diagnosis and treatment is very important to make sure that you don't have irreversible kidney damage and you can save or maybe increase some of that lost kidney function. Now, the person who asked me about this told me that he has a protein level of 400 and a GFR of 70. So a GFR of 70 is basically CKD or chronic kidney disease stage 2. And a protein level of 400 is pretty high, significant. It indicates that he's got substantial protein in his urine, and it reflects like a lot of kidney damage. So to understand the implications of this, so protein in your urine, protein is usually in your bloodstream, right? But when your kidneys become damaged, the protein is usually like, if this is my kidney right here, the protein's in my blood, it usually passes it right out. But when your kidneys become damaged, it's like you have a hole right here in your kidneys, and the protein just passes right through the kidneys and goes out via the urine. So when you have severely damaged kidneys, you have more and more protein in your urine that should be in your bloodstream. So protein in the 400 protein that you currently have right now in your urine is a significant sign of kidney damage. But you say your GFR was 70, so you're at CKD stage 2 right now, which is okay. You're not at CKD stage 3 or 4. You're definitely not at stage 5. So we definitely want to preserve the rest of your kidney function, because we don't want you to have an acute kidney injury or worse or chronic kidney disease. So your GFR of 70, we want to keep it there, right? We don't want it to progress any further. So GFR is basically a measurement that we use to see how well your kidneys are filtering blood and toxins. And we use it to assess how bad your kidneys are damaged. And this is with everybody. Diabetics, high blood pressure, lupus, it's the same test to see what your kidney function is. So a GFR of 70, like I said, falls into the stage 2 range of chronic kidney disease. So that's a mild reduction of kidney function. But with anti-GBM, I mean, even a mild reduction of kidney function is concerning, because anti-GBM can rapidly progress and move to more severe kidney damage, and we don't want that. So what do? Close monitoring and aggressive treatment is really necessary to prevent further loss of your kidney function. I said it again and again. I want to say it again. Anti-GBM disease can rapidly progress into stage 3, stage 4, and then end-stage renal disease or kidney failure. So we don't want this to happen. So you really have to make sure that you get the proper treatment that you need. You have a lot of protein in your urine. Your GFR is reduced. Plasma apheresis is something that you probably are getting right now to remove the anti-GBM antibodies that's in your bloodstream. I'm assuming that you're on some kind of corticosteroid right now. I'm assuming you're on any immunosuppressive drugs right now. That's what people usually get who have anti-GBM. They usually have steroids, other immunosuppressive drugs, and plasma apheresis to help get those antibodies out of their system. So what the goal is to basically tell your immune system to stop attacking the kidneys or the lungs, and stop preventing and prevent further damage to your body, because we don't want this to happen in the first place. So you really have to monitor your blood work. You have to monitor your GFR, your creatinine, your protein. You should be seeing your doctor regularly. I hope you are. It's really essential to assess how effective the treatments are for your body. Are the treatments working well, or do you maybe need some dialysis as well to prevent further kidney decline? So with timely and effective treatment, it may be possible to stabilize your condition. It may be possible to even improve your kidney function a little bit if the anti-GBM is what's causing it to go downhill in the first place. But if the disease continues to progress, there's a risk of a lower GFR and an increased amount of protein in your urine, and we just don't want that. So if that does start to happen, dialysis would be the answer to manage the waste that's building up in your blood and the fluids that's building up in your body. And also a kidney transplant may also possibly be necessary. But that's pretty much it. 70 GFR, 400 protein. That's like a mild kidney damage, a mild reduction of kidney function. But urgent medical attention is required to prevent the rapid progression of the disease. Closely monitor it, treat it aggressively. Plasma apheresis, corticosteroids, and other immunosuppressive drugs are what's really needed to make this anti-GBM not cause irreparable damage to your kidneys. Hope I answered your question. Hope I didn't just ramble on and on. Hopefully other people learn something too. Take care. Ciao.